Hi there, I'm just doing a quick tutorial on the app that I mentioned. This platform that you see here is called Prosthetic. It's a platform that I've been working on creating for the past 2 years. It's an educational platform into a configurator tool for prosthetists. It goes over the wide variety of lower extremity prosthetic components, including feet, knees, hips, and integrated systems. And it includes a wide variety of information to help clinicians find the best component for their patients. On the left here, you'll see the favorites and compare list where you can save products and keep them for review later or compare them to one another. But what I really want to talk about is prosthetic logic, and I created that to help physicians wade through the mountain of documentation requirements that are out there nowadays for prosthetic reimbursement. So if you click on that prosthetic logic link on the left hand side, and it will open this app here. And just a little bit of background, this information is all based on the Medicare LCD, which is the local coverage determination, and the policy article that dictate how prosthetic limbs are supposed to be documented. So if you want further information about that, I have the links attached here so you can click on them. You can read as much as you would like to, but that's where all this information comes from. But to simplify things, you just go through a couple of click and point instructions. You click on amputation level. We'll just keep in our minds that we have a sample BK patient here. You would choose the side of the amputation and their etiology. And then it goes over the functional levels. So the functional levels, there has been an update to the LCD, which includes tasks. So as an example, Medicare says that a K1 mobility level should be able to complete some, perhaps all of these tasks. So that includes things like has the cognitive ability to safely use a prosthesis, safely transfer and ambulate on flat surfaces inside the home. You could click on some or all. If you want to click all of them, you can just hit the select all button. When you have selected all the tasks in a particular functional level, it'll open up the next functional level so that it starts with K1. If your patient is a K2, you would click on the tasks that that the patient can perform and keep going down to the bottom until you reach the mobility level that the patient is safely categorized as. For this little section here, this is about advanced knee technology. So this only pertains to AKs. And so there's a lot of documentation requirements for if someone needs advanced knee technology, such as a microprocessor knee. So if your patient was an AK and they needed a microprocessor knee, you would simply click yes, and it would add information down below. But since this is a BK, I'm going to take that away. And then physical condition. Is this patient a new prosthetic user or have they had a prosthesis before? If you click yes, it'll add information down below. If you click no, it'll open up another set of options here. Whenever you're replacing an existing device, Medicare wants to know why. So perhaps the current prosthesis demonstrates mechanical wear, damage, or a functional failure. Perhaps just their socket no longer fits. Perhaps they've had residual limb volume change. We've had a lot of patients lately that are taking GLP-1 medications, and so due to weight loss, their residual limb volume and functional condition may have changed. And in some cases, patients' functional mobility needs have changed. Perhaps they started as a K1 and they've progressed to a K2 or a K3, or perhaps they're older and they've gone from a K3 and regressed down to a K2. But in this case, we'll say that this patient is a new user. And then documentation guidance. So these are clinical needs and environmental needs that are really beneficial, especially if your patient is more active. And it can help with getting them increased technology, access to things like hydraulic ankles and microprocessor knees and, things that exceed the basic level of care that sometimes insurances like to just approve on a basic level. So for clinical needs, if you hit yes, it gives you a list of some clinical needs that might pertain to a patient. So Perhaps they need additional residual limb protection. Maybe they have issues with their residual limb, that their skin is very fragile and they might need like additional protection against wounds that could cause further amputation. Perhaps they need shock absorption or impact reduction, or increased comfort for prolonged prosthetic use. Or perhaps, additional energy efficiency might benefit this patient. And then environmental needs are some of the terrain that a patient might encounter. Perhaps they have uneven terrain that they encounter for their everyday life or their job, or perhaps they have stairs or curbs that they regularly need to navigate, or higher level demanding activities for work, recreation, or something specific to their job. But I'll keep those off for now. And then if you scroll to the bottom, everything that you've done up here, just clicking these off, will give you an output. So it'll describe the patient's history and their documentation guidance. So the patient presents with a BK amputation, right side, secondary to diabetes. Patient demonstrates K2 level ambulation with limited community mobility. Patient presents as a new amputee requiring initial prosthetic intervention in order to regain as much of their pre-amputation functional capacity as possible. And then for the documentation guidance, the patient's clinical presentation requires additional residual limb protection and additional energy efficiency to reduce fatigue. Based on the patient's functional level, clinical needs, and environmental demands, a prosthesis is medically necessary to support safe ambulation, mobility, and independence. Now, these are the minimal requirements for a lower level patient with a K2 functional level and a BK amputation. When you're done with this, you can copy the text and add it to your EMR documentation. And whenever you're done, you can just hit clear all, and it'll bring it back to this blank state. But let's just say, as an example, that we had a higher level amputation, such as an AK or knee disarticulation, and they were a traumatic amputee, and they were a higher functional level, and they needed advanced technology such as a microprocessor knee, and they were a new amputee, and they had some clinical needs like shock absorption and environmental needs like community ambulation and uneven terrain. So if you scroll down here, the output has changed now, and it's substantially more in depth than the previous encounter. So it describes the patient's history, but also the documentation guidance, including a statement about the microprocessor knee technology and why that would be beneficial for the patient. Again, you could just copy that text and add it to your medical record so that it would be in the patient's notes. Of course, Medicare and other insurances require that information to be in the physician's notes and then corroborated by a prosthetist. So I created this document just to help physicians navigate all the requirements that are necessary for prosthetic care, because as you can see from these documents, they're several pages long. If you ever want to look at the LCD, it's quite an in-depth document. So there's just so much information, and it's hard to get through all that, and we know that you're busy. So I tried to make this tool to summarize everything and make it easy for you while also making care accessible to patients. So it is a tool that I made myself, so I can absolutely change it, alter it. If you have any suggestions, I'm open to modifying it and making it accessible. It's not proprietary to our company. It's something that you could use for any patient, for any referral source. It doesn't just have to be if they come to us. It's just basically to improve patient access to care and getting that documentation that they need. So I shared the link and how to find it. If you have any problems or questions accessing it, please reach out and I'd be happy to answer those questions. Thank you. Bye-bye.